is that time of year. The flowers beginning to bloom, trees and grass turning green. And we want to get out there and enjoy the nice weather. But spring allergies can leave many of us sneezing and sniffling and coughing and just feeling downright miserable.
Yeah, and in most of the South, it's at a very high tree pollen levels right now. Those in the northern states, you're probably beginning to feel that little tickle in your throat as well.
Yeah, that tree pollen increasing from south to north as we get that warmer weather in here. So to help us get some relief, Dr. Kasey Lanier joining us in studio this morning. She's an allergist here in Atlanta, so thanks for coming in. A lot of people suffering from the allergies. Julie, we were talking about that earlier. Are there particular parts of the region or the country that we should be prepared for the higher allergy counts more than usual?
Definitely. So the Northwest is the only one kind of protected this year, but the Mid and Southwest particularly in for a bad tree pollen season, and the Southeast, and especially Florida's in a unique situation this year.
Well, you know, when places are unseasonably warm in the winter months, like in the upper Midwest this year, does that factor in at all to what the spring allergy season will be like? It just comes earlier, right?
Yes, it does. Yeah, it absolutely does. And we know that with global warming, carbon dioxide increasing just makes trees bloom earlier, but also each tree more allergenic. So you're getting a longer season and you're getting a more difficult season.
You mentioned Florida standing out for a reason. Why is that?
Well, because of El Nino this year, Florida is normally warm and kind of having pollen throughout the entire year, but everyone kind of takes their turn as far as the pollens. This year, it was a little bit cooler there because of El Nino, pushing the whole tree pollen season back, and so now everything's going to blossom all at once.
So they're running behind schedule, and now everything's going to come out at once.
Yes, and then meet the summer pollen as well, so it's going to be difficult this year.
Oh, boy. Well, yeah, and you know, it does seem like it gets earlier and earlier every year. So how do you prepare for that, really? Do you stay on medication all year long?
That's a good question, yeah.
Yeah. Well, I mean, the first thing I advise is getting into the allergist if you're concerned so that you can really tailor your therapy, know exactly what your pollen problems are, so that you know when to be on medicine. Because sometimes it's not an allergic problem, sometimes it is. But yeah, there's three things you can do for allergies. Kind of mitigate them, use medications, and then immunotherapy. So allergy shots kind of microdose you to what you're specifically allergic to so that you can undo the allergy.
I don't know if this is a myth or not, but some people say to switch up your medications, like one that you might normally take year round, but your body builds up a tolerance to it. Is that a thing, or like should we be mixing it up?
Yeah, with the antihistamines, sometimes people do get a little bit of tolerance to them, and changing can help.
Oh. Okay. Well, there are a lot of different types of medicines out there where you get the pills, the nasal sprays. How do you know what to choose when you head to the drugstore? I mean,
right, over the counter or prescribed from you?
Yeah, all right, yeah.
So, actually, the nasal sprays do a lot of heavy lifting. Nobody likes putting a spray up their nose. But a nasal antihistamine, I really advise, because you can kind of use it as needed when you're having the bad days versus a nasal steroid that you have to be on top of every single day. And then an oral antihistamine. And if that's not doing the trick, we have leukotriene inhibitors too. So I would say do the nasal sprays if you can, and then start adding in the pills.
How about the air filters? Should we be, you know, cleaning them out more often or changing them out more often?
You should, yeah, especially around this time. Just even a portable air purifier in a certain room can be helpful.
You know, and in the break we were talking about things like, you know, taking walks when in the nice weather. Everyone wants to get outside.
Yeah.
We take our pets, and their pets tend to like bring everything back into the house, right?
Pollen, yeah.
Yes, yeah. So I would say with any pet, you just take at least a wet washcloth, a wet towel, and wipe the pets off twice a week just to get that extra dust mite, that extra pollen off that top coat, so at least you're not getting double exposure if you have pet allergy and pollen allergy.
And shower yourself, right? If you,
yes, yeah, you don't want to bring everything outside in. So when you come in, take your hat off, take your shoes off at the door, try to shower lest you bring it into the bed, and get everything off, and try to keep the window shut.
Yeah, I like to keep track of the pollen count too, just to see what's in the air and see what's bothering. That way I'm ready to tell you all about it.
Yes, exactly.
All right, thank you so much for coming in this morning, Dr. Kasey Lanier. We appreciate it. Let's take the dog